Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, the founder of the Facebook group Migraine Nation and chronic daily migraine survivor. I am super excited to tell you that I am here today with Dr. Amelia Barrett. Hello, Dr. Barrett. How are you?
Hi there. I'm fine, thanks. How are you today?
I'm great. So Dr. Barrett has been on Heads Up before. She is an awesome and very popular guest. Dr. Barrett is a board certified neurologist, and she is also the creator of the Migraine Relief Code, which is an online course for people with migraine. Today, we are here to talk about something that's been in the media a lot lately. We're going to talk about aphasia and migraine. The reason it's been in the media a lot is because Bruce Willis was diagnosed with aphasia. And I think it's interesting because I have talked to people with migraine who are like, well, I feel like that happens to me all the time. And that's probably because it can happen as part of a migraine aura. And so I thought we would bring Dr. Barrett on to talk to us a little bit about what we know about aphasia and migraine. So Dr. Barrett, let's describe what aphasia is, because it's not a word that we hear about very often until recently.
Right. So aphasia is sort of a blanket term that we use to describe difficulties with language. So it really falls into two categories. You can have trouble understanding language, or you can have trouble speaking language. So those are the two main categories of aphasia.
Okay, so let's make sure we get all the terminology correct, because we have had an episode previously where we talked about general speech problems related to migraine. So is aphasia different from dysphagia, or are those two terms used interchangeably?
They are different. Dysphagia is basically a milder form of aphasia. So typically as neurologists, when we're describing a patient with aphasia, we're meaning that they pretty much can't talk, or they pretty much can't understand language, one of the two. And so we might use dysphagia if this is more partial. So for example, maybe somebody, instead of saying, I am going to go set the table now, they might say set table. Do you see what I'm saying?
Right.
And we would call the latter dysphagia as opposed to a full-on aphasia where they really can't say that sentence.
Now, in either case, can they be transient, or when someone's diagnosed with this, is it there all the time?
Well, I would say in general, neurologists use those words to refer to a more permanent condition. Although absolutely, we know that when it's part of a migraine aura, it is reversible.
Okay.
So the words can be used either way.
Okay.
And I just want to be clear, it's not really a diagnosis per se. There's nothing in the word aphasia about why you're having an aphasia. It's really just a description. So this is one of those situations where, as a doctor, a patient comes to me and they tell me what they have in English, and then I tell them what they have in Latin. So nothing has really happened here, except we've sort of repackaged the set of symptoms that the patient is having. So that's really what aphasia and dysphagia mean. They're just descriptions of what's happening. It doesn't really tell you why.
Okay, and before we delve into this deeper, I do want to clarify one more term that I know many of us with migraine hear around migraine and around migraine aura, and that is dysarthria. That's another word used associated with our speech problems. What does that mean exactly?
I'm glad you brought that up. Yeah, that's a really good point. So dysarthria really refers more to the muscular production of speech as opposed to the actual comprehension of speech or the generation of words.
Interesting.
So, for example, if you have ever observed somebody who's had a little too much to drink, their speech might be dysarthric. They understand what you're saying just fine. They can speak just fine. It's just the production of speech that isn't working. Does that make sense?
Yes. Okay. So many of us have experienced strange speech, there you go, issues associated with our migraines, especially during the aura phase. So can you talk about why that happens during our aura?
Yeah, really good question. Okay, so what's happening during a migraine aura is that the blood vessels in the brain are vasoconstricting in a certain part of the brain. And here's what that means. So if you imagine your blood vessels like this, okay, this is an artery right here in the brain, let's imagine. What's happening during vasoconstriction is they are literally shrinking down.
Mm-hmm.
So the part of the brain that that blood vessel is going to isn't quite getting enough blood flow. And
Mm-hmm.
that's why that part of the brain doesn't work right. That's why
Right.
you can't speak or understand language.
Right.
So with migraine, this is a temporary thing,
Mm-hmm.
right? 15, 30, maybe 45 minutes later, those blood vessels are going to pop back open.
Right.
That's when you start getting your pain and the
Mm-hmm.
neurological symptoms go away.
Okay. So some of us have this happen all the time. I can say, I think many of our viewers are aware that my chronic migraine started when I was 4 or 5 years old. I was in preschool. This symptom honestly was such a normal part of my life. I hardly noticed it until one time I was at work and someone asked me if I had taken a medication that made me slur my speech. And I was like, nope, this is just me. I'm getting a migraine. I was like, wow, I thought most people just knew that this is how I spoke. So I never find it particularly shocking. But if someone experiences this for the first time, how do they know it's not something more serious like a stroke, et cetera?
That can be tough. So just to backtrack for a minute, I'm so sorry that all this happens to you.
It really, I really did, and migraine is just so normal in my family. I didn't realize how unusual it was, but now I can see like people must have thought I was crazy at times when it was really noticeable.
Oh my goodness. And this was your norm. Anyway, yeah, I do think it can be tricky to figure out if it's a stroke or a migraine, because when you're in minute 1 of a 30-minute event, you don't know what's going to happen at minute 30, right? Is it going to go away and it was just a migraine, or is it going to not go away? And this is the first bit of a stroke. So,
right. And I can see if it's something that you've never experienced before, especially if it's associated with other symptoms of a migraine, it would probably be very scary.
Absolutely.
Mm-hmm.
And so rule number 1, it is never wrong to go to the emergency room. That's what they're there for. I think if you have never had migraines and this happens to you, absolutely go to the emergency room. Now, probably most of the people who are listening to this have had migraines before, and that makes it a much harder decision. Mm-hmm. So certainly if you have a history of auras, if you see flashing lights or blind spots or numbness or tingling, if that has happened to you before your migraines, then your speech symptoms are more likely to be a new type of aura. That happens. Auras change, not a big deal. It's scary the first time it happens though. So if you have had that experience in your past of having these complex neurological symptoms before your migraines, you might stay home and wait it out. Right. Okay. If you have never had neurological symptoms with your migraines before, you might not want to stay home and wait it out. And here's why: because there are super effective clot busting drugs that can be given for stroke, but you've got to get to the emergency room in time. You've got to be there so they can go through the whole process of evaluating with you. And then they have to give these medications within a certain window of time. So it really can be a tough decision, but I think that, one thing people can use is whether or not they've had neurological symptoms with migraine previously, they can probably relax and wait. If not, you might want to err more towards going in, but again, it is never wrong to go to the emergency room. They're here to help. That's what they're for.
Do we have any indication, and I'm not even sure if these numbers exist, of how common aphasia is in the migraine population?
Oh my gosh, that is a really good question. And I don't have official statistics, but I'm going to say maybe 1 or 2% of my migraine people. Okay. It's not a huge percent. And it is usually more of a dysphagia. I find it to be pretty rare that people completely can't talk. They might feel like they really have trouble getting their words out. They're trying to say, bring me my medicine, and all they can get out is medicine or something like that. That seems to
Right.
be the more common experience, to have it really be more of a dysphagia.
I would say that my experience in the people I meet and in myself, it's very similar. But I do think that people use the term aphasia with us, even some doctors. And so people had always used that term with me until I was like, I don't know that that's really what I'm experiencing. It's more of a dysphagia. So that is very interesting. So I have another really important question that I think that we should clarify here. So many of us take preventive medications. For example, one very common one would be topiramate that cause certain, it sounds like a speech problem. For example, we'll word search. We can't think of a word, etc. Is that similar to this, or is that more of a cognitive issue?
That is really more of a cognitive issue. And the
Okay.
reason I say that is there's really no vasoconstriction involved. It can happen at any time, not just before a headache. So it is really more of a cognitive side effect of the Topamax or
Right.
topiramate or Trokendi. They're all three basically the same drug. So
Right.
yeah, super common side effect of that one.
I think it's important, since so many people take that medicine, it's important for people to be aware that if they are having what feels like a speech issue, it could also be their medicine. It might
Mhm.
not be an aura, and it might not be dysphagia. It could be with a side effect of their medication.
Yep, really good point.
Yeah. So is there anything else you'd like to add to our topic of aphasia, dysphagia, speech problems, and migraine aura?
No, I don't think so. But certainly, if anybody has any questions, you can drop them below the post, and we'll do our best to get back to you, get you the information you need.
Great. All right. Well, thank you so much, Dr. Barrett. And thank you, everyone, for joining us on this week's episode of Heads Up, the weekly webcast and podcast of the National Headache Foundation. Bye, everyone.